Ingrown toenails are a common problem affecting especially the big toe. Appears when one of the upper corners of the nail penetrates the flesh that surrounds it. This causes redness and swelling, inflammation, pain and sometimes infection. There are factors that favor the appearance of an ingrown toenail. Improper nail trimming is the most important factor in the occurrence of an ingrown toenail. Ill-fitting shoes that are too narrow, exerting pressure points and promoting significant sweating of the feet promote the incarnation of the nail. Most ingrown toenails can be treated at home with the following care. Soak the foot for 15 minutes in lukewarm water to which a little salt or an antibacterial soap is added. Gently lift the edge of the softened nail by placing a small piece of clean cotton between the skin and the nail, which will help the nail grow above the skin. Apply an antibiotic ointment to the painful area. Wear open-toed sandals or a comfortable soft shoe until the pain and swelling subsides. When the care provided to your ingrown toenail is not enough, surgery may be necessary. The surgery is performed under local anesthesia in most cases. The surgeon works on the skin around the nail and on the nail itself. He removes part of the pulp or the bead at the level of the skin which borders the nail and cuts the ingrown nail itself. The healing after the operation of the ingrown toenail requires a rest of 3 days. Standing should be avoided and walking as little as possible. The ideal is to keep the foot elevated to promote proper healing of the ingrown toenail. 2 to 3 weeks are needed for complete healing.